Now, for example, here we can see some derivatives of meningeal membranes.
We'll try to understand कि यहाँ का यूनिवर्सिटी कैसी है, कल्चर कैसा है, प्रोग्राम्स कैसे हैं, स्टडीज़ कैसे होती है, इसके बारे में, क्योंकि ये जो मेजर क्वेश्चंस है जो हमारे पास स्टूडेंट्स जो है काउंसलिंग सेशंस में पूछते हैं.
First of all, the curriculum is really nice. Second of all, they're very super diligent with their curriculum. I have to say they're very strict.
For example, this one, Mannequin for physical examination and cardiac system. Если я неправильно, вы поправляете.
Да.
Cardiac system.
Can you please give us a brief introduction about this lab and the university in general?
I glad to meet you in our human department, Department of Human Morphology of our university. In our second, this museum, exhibition of this museum includes a lot of specimens that describe anatomy of internal organs and anatomy of nervous system. The entire museum exhibition of our museum is used during practical classes with our students, not only Russian-speaking students and English-speaking students too. Let's look some compartments of this exhibition. The first boxes include some specimens that describe anatomy of digestive system, from oral cavity to the last compartment of digestive system that's called rectum. Next system of our plan with the student studying its respiratory system. Of course, it's posterior view of lungs, and we can describe here topography of this organ. There's some projection to skeleton, projection to some walls of thoracic cavity, and relations with the neighboring organs in the cavity of location of this organ. And of course, here we can see some specimens that describe anatomy and development of larynx, like here in adjacent organs. Now, for example, here is larynx, trachea, and bronchi of adult person. Now, the next box includes specimens of some organs of urinary and reproductive system. Now we can see here not only normal organs, we can see here one variant of abnormality. Now, this abnormality of kidney is called horseshoe kidney.
Horseshoe kidney.
Horseshoe kidney, yes. Now the next museum box describe anatomy of reproductive system and partly development of the main organ of
embryo?
Urinary system. It's embryo kidney.
Okay.
It's embryonic kidney. But we can see here not only urinary system, we can see here some organs of reproductive system. For example, it's the full complex of female reproductive organs, and internal and external. Now, this box includes only organs of reproductive system. We can see here and male and female reproductive organs. In sagittal section, now we can study with our student relations with other organs in pelvic cavity. Well, for example, what else? We can see here not only adult anatomy, we can see here and study with our students child anatomy. Let's look next very difficult part of this exhibition, this museum, that describe anatomy of the most difficult organ of human body, its brain. Now, this part of exhibition includes specimens of brain from the beginning stages of development of these organs. Now we can see here brain of fetus. It's 9-month-old fetus. Or not month, 9-week.
9-week-old. Oh,
yes, of course. And a lot of specimens that describe anatomy of each part of brain of adult person.
And what are these?
This is cerebellum.
Okay.
Now we can see here what we can see here: cerebellum and partly medulla oblongata. And what else we can see here? And pons. That these parts of the brain are called rhombencephalon, because they develops from rhombencephalon, it's embryonic part of the neural tube. Neural tube is the most beginning embryonic structure. It's source of development of other parts of nervous system. Now, for example, here we can see some derivatives of meningeal membranes that protects the brain. Now I think we can go to our next museum. This museum includes and describe some features of anatomy of cardiovascular system, anatomy of lymphatic system, but I want to show you some very specific and very unique specimens that made in laboratory of our department. Now we can see it here or here. Now this methods of preparing of anatomical specimen is called plastination. Now this method includes changing water and fat in tissues on the silicone or other polymers. It's a very modern method of preparing, and this method used only in 2 laboratories in Russia. In our country and in a medical academy named after Kirov in St. Petersburg. Now this one is specimen of the knee joint that made by method of plastination in our laboratory.
This is prepared here in this university?
Of course.
Oh, okay.
Of course. And our student can make,
They can also
of course, this type of specimens after our
So all
classes.
these are made in this university?
Yes, of course. All of this
And
this body, of course, and these specimens are made here. And we have a lot of specimens that made by this method that we are used during our classes. Of course, these are specimens that describe some abnormalities, the abnormalities of developments. This discipline that studied abnormalities is called teratology. Teratology. It's very, very small compartment of our exhibition, but it's very interesting. Our student can study what types of some abnormalities of development they can look in clinical practice, first of all.
it's very good to know that student gets to get the real hands-on practice and the visualizations of everything that is going to happen with them when they are certified doctors.
Of course, yes.
Prepared from the very first itself.
Yes, of course. Let's go to the next floor.
Okay.
Guys.
Hello everybody, very good afternoon.
My name is Riva. I'm from Delhi. I think after NEET, when I consulted my parents, I always wanted to pursue MBBS. That was for sure. But बहुत obvious है India में getting an admission in a private medical college, especially when you don't make it to NEET. It is very heartbreaking, but at the same time, you need to think that it is going to be expensive. And when you think of pursuing MBBS, it's just not like, there's no limitation to it. आप कहीं से भी पढ़ो, आप बनोगे डॉक्टर ही. So इसीलिए when I was talking with my parents, we figured that maybe moving to Russia was a good option. And then how this university it just stands out in so many different ways. First of all, the curriculum is really nice. Second of all, they're very super diligent with their curriculum. I have to say they're very strict. So that is for one thing. And the overall experience has been nice. And I just think that it was a pretty good decision. Keeping in mind the financial status and everything else, honestly. Coming here has been nice.
Okay, so just few questions from my end. So let's
Mm-hmm,
say
sure.
आपकी जैसे यहाँ पे classes चल रहे हैं, so are they being taught in English and क्या वो हमारे syllabus के accordingly है या नहीं है from the Indian standards point of view?
Definitely it is. So all of it is taught in English. Most professors do understand English, although कभी कभी उन्हें थोड़ी बहुत प्रॉब्लम हो सकती है because obviously they're Russian natives, so they might confuse a few words, but overall they do understand basic English. And the teaching, definitely all of it happens in English. You don't have to worry about that. Plus for the first 2 years, which is 4 semesters, हम लोगों के Russian language के classes भी होते हैं. So that is also there.
Okay, so what about the accommodations and the mess services that you have? आप लोग कहाँ रहते हैं? कहाँ पे आप लोग की accommodation है? के अंदर है या थोड़ा कहीं travel?
We have 2 campus hostels basically. One is inside the campus and the other one is outside the campus. So it's basically your own choice whether you want to travel or not. सबका अपना personal preference होता है. Everyone has their own choice as to where they want to live. The living conditions are almost the same in both the campuses. And other than that, everything is pretty comfortable. Once you get used to it, it's very comfortable.
Okay, and what about the mess facilities? Do you have, so you prepare your own meal, right?
Yes, we prepare our own meals.
Okay, that's very good to know. So anything that you would like to say to the future doctors?
If in case anyone is genuinely thinking about moving to Russia, it is a good decision. Every decision has its own pros and cons. This does too, but I think if you're getting a degree, I think it's worth it.
All right. Just a second. One second, please. How many of you studied from physics, Wallah? Okay. Almost all of them. Okay. 99%.
How did you get to know about this university? तो पहले ही सबने अपना मन बना लिया था कि इसी यूनिवर्सिटी में आना. ऐसा होता नहीं है नॉर्मली. बट कैसा लग रहा है आपको मतलब यहाँ पर रहकर?
अच्छा तो है.
अच्छा.
फॉर्मर कैपिटल है, यूरोपियन स्टाइल बना हुआ पूरा.
सिटी तो अच्छी है. आप जब इंडिया वापस जाओगे ना तब आपकी जर्नी होगी स्टार्ट. एंड इट्स वेरी 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 टफ. वेरी टफ. क्योंकि आपकी पेरेंट्स की एक्सपेक्टेशंस होंगी. ठीक है, तो बिकम अ डॉक्टर. तो एडवाइस ये ठीक है कि आप अच्छा पढ़ो. ठीक है, अगर फिजिक्स वाला से आपको कुछ हेल्प चाहिए या प्रोफेशन से या फिर की हेल्प चाहिए, ठीक है, एजेंसी की तरह काम ना करें कि छोड़ दिया दूसरों को करें. तो मैं ये चाहता हूँ कि अगर हमें कीना भी है तो आप अच्छी तरह करें. कि आपको अगर पढ़ाई के लिए टीचर्स मिलें, ठीक है, कि आपकी रोज़ एक ऑनलाइन क्लास हो. जैसे हमारी ऐप में रोज़ ऑनलाइन क्लास होती है. ठीक है, अब वो पढ़ना आपको ही है. हम कुछ नहीं करना, पढ़ना आपको ही है. बट प्लीज़ पढ़िएगा क्योंकि मेरी वाइफ डॉक्टर है. सो शी इज़ एम्स दिल्ली. ठीक है, एंड शी इज़ असिस्टेंट प्रोफेसर साइकोलॉजिस्ट. वहाँ पे MBBS स्टूडेंट पढ़ाती है. तो मैं उनको देखता हूँ वो आज भी पढ़ती है. डिस्पाइट बीइंग 42 ईयर्स उसको आज भी बहुत पढ़ना होता है क्योंकि पेपर पब्लिश करना होता है आपको.
आज हम लोग AcadFly की टीम आज आई हुई है नॉर्थ वेस्टर्न स्टेट यूनिवर्सिटी सेंट पीटर्सबर्ग रशिया में. और आज हमारे साथ मैम अवेलेबल है, मिसेस नटालिया मैम. शी इज़ द हेड ऑफ इंटरनेशनल एजुकेशन डिपार्टमेंट. और आज हम इनसे थोड़ा सा बेसिक इंटरेक्शन करेंगे. विल ट्राई टू अंडरस्टैंड कि यहाँ का यूनिवर्सिटी कैसी है, कल्चर कैसा है, प्रोग्राम्स कैसे हैं, स्टडीज़ कैसे होती है, इसके बारे में. क्योंकि ये जो मेजर क्वेश्चंस है, यही मेजर क्वेश्चंस जो है हमारे बच्चों की तरफ से हमारे पास आते रहती है, जो हमारे पास स्टूडेंट्स जो है काउंसलिंग सेशंस में पूछते हैं. एंड वही सारी डिटेल्स हम डायरेक्टली नटालिया मैम से ही डायरेक्टली पूछना चाहेंगे. ऑलराइट, थैंक यू सो मच मैम फॉर इनवाइटिंग अस टू यूनिवर्सिटी. इट्स अ रियली प्लेजर एंड इट्स एन ऑनर फॉर मी to be having a word with you. So ma'am, we'll start with the basic questions that we receive usually from the students. That how is exactly Northwestern State University different from any other universities for that matter in Russia, and what makes it apart? What makes it different?
First of all, namaste. St. Petersburg, probably you know, is the second capital of Russia. We are also called like cultural and educational capital of Russia. Just at the beginning of Russian Empire, the first university was established here in St. Petersburg by Lomonosov, who is a very profound scientist, Russian scientist. Secondly, exactly. Our university is campus-based university, and today you saw it. The territory of the campus is quite vast, and one of our hostels that we offer for students, both domestic and international students, is located directly here in our campus. So the students have very fast and easy approach to all educational buildings where they do their classes and so on. Moreover, our university has its own clinic. This clinic is of the federal level. The clinic is called the Hospital by Peter the Great. Just here we have 800 beds, and we have 5 more our own clinics, and we have made a contract with about 200 clinics more, so that our students and residents could be provided with the opportunity to undertake the clinical rotations normally, how it should be in compliance with all medical requirements and requirements of different agencies that verify and recognize the diplomas. Moreover, our university merged with the Diploma of Postgraduate Medical Education in 2011, and we started training not only future doctors, but also residents, these are for the doctor's specialty, and practicing doctors. All vocational courses and retraining courses, we provide more than 200, more than 200 retraining courses for practicing doctors annually. And more than 80 specialities at the residency level we have here at our university. With the exception of general medicine, we teach all other medical programs, also preventive medicine, dentistry, pediatrics, just osteopathy. By the way, we are the only medical university in Russia who implements such a curriculum as osteopathy at the level of specialty. All other medical universities implement only residency programs for specialty.
That's very good to know.
Yes, really. Our teaching staff is really professional and very big, by the way. And students to teachers ratio is about 7 students per 1 professor. Moreover, if you check in the internet, we occupy good positions in international rankings. We are ranked by Times Higher Education and also QS University ranking. There are not so many Russian medical high schools that are included into these rankings. Currently, Indian students study at first 3 years at our general medicine EMI program, and we hope that in 3 years we will start awarding them in early July with diplomas, and wish them good luck with their future medical prospects.
Thank you so much, ma'am. Thank you so much. So, ma'am, there are few basic concerns from the students as well. So, since they are living in India, they have their own way of style of living. They have their own cultural way. So, how does the university actually help in the first year of their completion of the course when they come to the Russia in general and particularly Northwestern State University? So, how does the university help them to fit them culturally?
It's a very good question, because that is a problem, really. And here, not only the university should do something for easy and fast adaptation of students. It is also students' involvement. Students cannot procrastinate in the hostel all day long,
Yes.
not going out even, cannot miss classes and have hope that they will adapt to new lifestyle very easily and very fast. Yes, St. Petersburg is not a simple city. It has a very I wouldn't say severe, but has totally different from India climate. Probably it might be compared with such a state as Kashmir. We also do have 4 seasons, like normal winter, normal spring, normal summer, and normal autumn. And the person who has arrived here should get prepared firstly physically. Just should understand that during winter period, they shouldn't go out in slippers, for example, into the street. No, it's too cold. You will start getting ill. They should wear normal, appropriate jackets, a cap, for example. It's important. Do not think that you are from a hot country with hot blood and you will not get cold. And there are even cases when students get to by ambulance are delivered to the hospital with such a diagnosis as pneumonia. You do not need it, believe me, like this. We have launched special initiatives by the university that focus on students' adaptation here. First of all, the Department of Foreign Languages just offers one discipline from the curriculum of General Medicine EMI, where we explain students how to live here, what to do, and so on. Moreover, students share the dormitory with Russian students and students from other countries, so they have a very good chance to communicate with different cultures, with students from different locations of the world. Currently, we have international students from more than 40 countries. Imagine. Our educational department organizes special events where students just have a chance to learn something about the discipline that this department implements, and even to play different educational games like quizzes, quests, and so on and so forth. They even have an opportunity to dance at the sports department if they want. Also, student scientific community works at the university to involve them into future scientific research that is important for becoming a good doctor in the future. And different students' activities that are organized by the department responsible for extracurriculum activities for students. So please welcome. Do not stay at the dormitory.
Okay. So ma'am, one piece of advice that you would like to give to the Indian students who are planning to come to Russia and Northwestern State University, because there have been, might have been cases wherein students find it, as we mentioned, like there have been differences in the culture. So what advices would you like to give? Maybe, start with understanding, learning basic Russian, or maybe to know about the etiquettes. Any advice, any piece of advice that you would like to give?
First of all, you all who plan to come to Russia for studies have to read about Russia. You should understand that Russia and India are friendly cultures, friendly people to each other, but we are totally different culturally and socially. So please Google, please find all information that will be interesting for you personally, and that is objectively needed for you before coming to Russia. That is the information on climate, the information on society. We are totally, by the way, civic society, and we have a civic etiquette to follow at such official establishments, like, for example, medical university. The etiquette, how to communicate with people of different ages and different social statuses, the manners. For example, you should understand, like St. Petersburg is located in the northwestern region of Russia. This city is very close to the border with 3 European countries. Only 100 kilometers we are far from Finland and Estonia. So in our culture and our social behavior, we look alike with these people of northern countries. And for example, we like distances, and the distances during communication with other people is much longer than, for example, in India or Uzbekistan, Kyrgyzstan, and Kazakhstan, such countries. Just another thing is we do not crowd outside. The maximum number of people that you can see who are St. Petersburgese, just we go along streets by couples or in threes. You see, not like a big crowd. Just we are much more silent than Indian people. We try to make our voices not so loud when we are in the public places, for example. Guys, please remember that shoplifting is a crime in Russia. It's really a crime. So all supermarkets and even streets are equipped with cameras, and people who shoplifted even for the fun or for some kind of competition can be tracked by police via cameras, and they will get jailed and after that deported from the country with a ban for re-entry. It's very serious issue. I'm always explaining it to students from other countries, not only from India, but from other countries as well. So it's not a joke. And moreover, you should understand that Russia carries out the policy like anti-terrorist policy currently, and you shouldn't misbehave outside, really, and inside the university as well. If there is in the university rule, if it is said in the rule of the university that alcohol and smoking are banned at the university and in the dormitory, it means that they are banned. You shouldn't hide and smoke inside. No, it doesn't work. We have cameras, we have people who track, like security guards. That is why it is safe here at our university campus. Also, you should learn about the style of clothes you choose. Again, we are more civic, and sometimes your beautiful Indian dresses can be not only inappropriate like in the society. No, it's okay. I also wear Indian dresses, but all dresses, all clothes you choose today should just comply with the weather conditions. Really. It's important for you because to be a good student, you should have good health. You shouldn't be ill. It's very important. Moreover, never just what I wanted to say. Take care about yourself in advance. When you come here, make medical insurance and pay for it, good sum of money, because the better medical insurance is, the better medical service you will get if something happens to you. And also you should understand that you are here for whole 6 years. It's a long period, really. So try to respect our culture. So it means that other people will respect you here at the university. Try to make friends with students from other different
Multiple nationalities.
yes, because we are a multinational community, multinational studentship, and we respect each other's religion, each other's culture. So please, respect matters here in Russia.
डेफिनेटली सो बच्चों, आप लोग ने सुन ही लिया होगा जनरल एडवाइस जो आपको मैम ने दिया है, क्या क्या करना है, क्या क्या नहीं करना है. जस्ट टू सम इट अप, कल्चर के बारे में पढ़िए, लैंग्वेज के बारे में पढ़िए, पीपल के बारे में पढ़िए, सोसाइटी के बारे में पढ़िए, एंड फर्स्ट और उससे भी ज़्यादा ज़रूरी चीज़, आप जिस माइंडसेट के साथ यहाँ पे आ रहे हैं यूनिवर्सिटी में पढ़ाई करने के लिए, उसको कभी नहीं भूलना है. 6 साल एक बहुत लंबा पीरियड है इस यूनिवर्सिटी में, इस कल्चर को समझने के लिए, लैंग्वेज को समझने के लिए. उस पर थोड़ा सा ध्यान दीजिएगा, एंड रेस्ट जो आपकी पढ़ाई है दैट विल बी टेकन केयर ऑफ मैम एंड द डिपार्टमेंट एंड द एंटायर यूनिवर्सिटी. So yeah, that's all from my side. Thank you so much, ma'am. Thank you so much for giving your valuable time and explaining us about all the universities, about the procedures and everything. It's really a pleasure to meet you, ma'am.
Thank you for your interest.
Thank you so much, ma'am.